So those are some basic thoughts, some fitness regimes that some of the most, fittest men in India really do. And like Milind said, you don't have to be absolutely fit. He calls himself a lazy person and still is one of the fittest around. So then, talking about it, we thought we'll talk to some people who are in the business of fitness as well. Let's bring in Ravi Krishnan, CEO and founder of Stepathlon, is with us this morning. Hi, good morning, Ravi. Thanks so much for joining us. My first question to you is, are you at least or at all surprised with the Lancet report and what it throws out? Because like when we talk to people, we seem to believe that we are getting fitter as a country, but the numbers speak otherwise.
Yeah, I got to say, it wasn't that surprising to me. I think it's a combination of factors, culture, commerce, the environments in which we live and work now really promote sedentary lifestyle. So, it's not surprising at all. And I think it's something that, needs to be addressed swiftly. It's principally due to lifestyle, and therefore it can be addressed. And I think notwithstanding the pressures of life, everyone has to take responsibility for this, because otherwise it becomes generational. Kids follow this example set by their parents, and I think it's incumbent upon this generation to set example to the next generation, because the generations coming after us also grew up with screens. We didn't have screens. When I was growing up, you spent all day outside playing and then came inside, had dinner, did your homework and went to bed. But now kids are on screens all the time. So this is not just about now, it's about our future. It's not difficult to address. A little bit of physical activity, addressing your consumption. It's still 80% what you eat. So these things can be addressed, and I think it's time for India to do that, because otherwise it's going to be huge. It's going to put a huge stress on the healthcare system, and it's going to cause people to pass away much earlier than they should.
Yeah.
There was this sense, though, that after the pandemic, we'd all sort of realized, especially with the prevalence of articles, that our health mattered. You could, and you were talking about screens, you could finally go online and take classes from the comfort of your own home. Did you not see that change happen? What do you think there?
Firstly, you used a word that's really important: habit. Changing habits is not easy. You can do it for a short time, which is what happened with COVID. You had this surge of focus on health in the early stages of COVID. Then when people realized that COVID wasn't disappearing fast, actually what you saw was more consumption of alcohol, sugary foods, et cetera, et cetera. The other thing you talk about is clubs and gyms, et cetera. Having a gym membership and using it are two separate things. I know there's $1 billion of unused gym memberships in Australia, and that's supposed to be an active country alone. So I think, buying something and using it are two very different things. Lifestyle change has to be something that's sustainable. There's no point, just going intensely for a short period of time and then stopping. The other huge enemy to the health of the planet, the number one enemy, in my view, is sugar. Refined sugar and sugar in all the forms it comes. We use sugar culturally as a reward, giving your kids cakes, chocolates, gulab jamun, jalebis, whatever. That's bad for the health of the country. So, look, it's one thing is movement. The other thing is nutrition. And these things, if we can address these two things, we can change, what is a slippery slope.
You're right. You're absolutely right that one thing is nutrition, the other thing is movement. But WHO seems to focus more on movement. In fact, they have defined a fit person as somebody who puts in about 150 to 300 minutes of exercise per week. That's roughly 30 to 45 minutes every day. Is that also too much for people to do? Or are we sort of losing the plot here? We've just not been able to put the focus on wellness. We seem to put a lot of focus on illness.
And also, by the way, I think and this is something that we at Stepathlon, our company, and as you know, we work both in the fan engagement space and in the corporate wellness space. This is something that we really emphasize, which is you don't need to look at just formal exercise to be fitter. Every time you're on the phone, if you're on your feet walking around, they're mobile phones, as long as you're not on the road, those steps that you take are invaluable. All movement is good movement. You don't have to be in the gym to be fitter. So that 45 minutes can be achieved in many different ways. It also doesn't, ideally, it's consecutive, but it doesn't have to be. If you only have 10 minutes, go for a walk, get outside, get some vitamin D. I exercise as much for my mental health as I do for my physical health. So I think, we've been, a lot of the marketing from companies in the health space have made us feel like we need fancy equipment and memberships and this. We don't. There are many ways in which you can, achieve that 45 minutes, and I don't think we should see that as intimidating. It's easy to do. You can juxtapose it with other things that you're doing, and that's what I do. I mean, and a lot of business people who travel gets in the way of their activity. I use airports airports are an opportunity. You can do a lot of walking in an airport. You can achieve these steps very easily. So that's what we try and do at Stepathlon, show people that in busy life and within busy lives and lifestyles, you still can achieve a level of activity that is good for you.
So you're kind of already giving us pieces of it, but you're 56 yourself. What is your definition of staying fit?
I'm 56. So so no spring chicken. Look, for me, I think it's about moving as much as I can. So I'm on my feet a lot. As I said, I spend a lot of time on the phone, but most of that time is on my feet. For me, I try and achieve 10,000 steps a day outside of my formal activity. I like to go to the gym. I like to swim, play tennis. So I think 10,000 steps plus whatever is my goal. But I don't put pressure on myself like I have to go for a long walk or whatever. I grab moments. I do like to do it in one chunk if I can. I love food. I'm a big foodie, so and I like all sorts of food. But I think at a certain stage of your life, you need to be aware of what you eat. And I think for me, staying away from processed food to the extent that's possible, and it's not easy, as much as I can, is what I do. Less sugar. I mean, sugar is really the enemy. I mean, people don't understand. It's insidious.
Yeah.
It's everywhere. And I think that refined sugar, I mean, sugar in its natural form, in fruit, in vegetables, it's great. But, the refined sugar that is thrust upon us in all forms is deadly. And I think also I think, as I said, get outside. It's important to be outside. Vitamin D is really, really important. And then for me, doing things with other people, going for a walk with your friends or going to the gym with your friends, going for a swim. I think, that the community aspect of being active is really great.
True. Ravi, also tell us, the data put out, one of the key highlights is women being more unfit than men. In the India context, it's very hard to believe when women are still sort of doing a lot of labor at home. How do you read this statistic?
Yeah, look, I think culturally, and this happens a lot in what have historically been patriarchal societies. I think that's probably not surprising to me, but the fact that it's getting closer and closer to equal is actually a good thing. I think we're moving in the right direction. I would be curious to see what those numbers were pre-liberalization, for example. I think that'd be much worse for women. So it's getting better. I have a 22-year-old daughter who was born in India, Myra, and and certainly she's more aware of being active and I think than perhaps my mum was. So I think we're moving in the right direction. We're very focused on women's health at Stepathlon. In fact, we've just done a big deal with a major global women's event, which we'll announce soon. And I think it's about setting examples. It's also about, look, you don't have to go to the gym. Like I said, dancing is great. Dancing is great movement, and walking with your friends, and also we got to deformalize what is exercise. Movement. We like to focus on movement. We call ourselves the movement for movement. So I think, look, in the countries where culturally women were kept at home and kept in the kitchen. This is what we got to break. We've got to basically, move to more equality. Fathers, parents have a lot to answer for, fathers and mothers, in terms of what kids consume, in terms of what kids do. Historically, in places like India, sons and daughters have been treated differently. I don't think that's not helpful.
That's such a powerful answer. Can we just ask you, going back to kind of the cultural themes we're seeing, it feels like a paradox. You either have people who are cycling to death, fitness is everything, or there's no exercise at all on the table. How do you address that?
Well, firstly, just there are many Indias, as you pointed out earlier. Urban India versus rural India are two different things. I think what we're talking about is an urban India phenomenon. It comes with increasing wealth and an ability to catch up, because India didn't have many of the opportunities it has now. But look, I just think, like I said, it's incumbent upon our generation to recognize things like the Lancet study and make steps. And moving towards health and fitness is incremental. It's not, you can't go from where you are to eating lettuce, drinking water, and going to the gym 4 hours a day. Set goals, set ambitious goals. Move incrementally, keep moving. Just make small changes. Small changes can really make a big difference. But most importantly, I think this generation, the older generation, have to set an example for the future generations. And these things can turn around very fast. Lifestyle disease is called that because of the way we live. We're the only animals that every day will eat what's bad for us, drink what's bad for us, smoke what's bad for us. We do things that are counterintuitive. You put bad food in front of a dog, the dog will walk away. So it's behavioral, and I think it's and I think we can address it. So it's not it's not just downhill from here, but I think it's incumbent upon us to take this responsibility. And it's great that organisations like yours are highlighting this and getting the word out to people about the study.
Okay. Ravi, thank you so much for joining us this morning, for bringing us your analysis of why so many of these trends exist. Now,